So, when to call the vet, part 2. A few words about colic, because colic is still one of the most common reasons for being called out to horses or being called by anxious owners. What I want you to do is remember the word react, because we will use that to help you assess whether your animal has colic and possibly how serious it is. So R stands for restless and agitated. Is he walking around the box? Is he lying down, getting up? Is he showing signs of being upset and restless? E of react stands for eating. Has he got an appetite? Has he eaten up his feed? Is he interested in food, or is he showing inappetence, and has he not cleared up his hay net? The A stands for abdominal pain. Is he showing tummy ache? Signs of tummy ache? Is he kicking at his belly? Is he turning around to look at his belly? Is he sweating? Is he clearly uncomfortable? Some people confuse it with them having a fly there. It can indeed look like that. But no, any signs of abdominal pain. The C of react stands for any clinical changes. And this is where we talk about the heart rate, the pulse rate. Are they in the normal range or in the abnormal range? Are his membranes a healthy colour, or are they very, very dark or very, very pale? Can you hear his tummy rumbling? That's normally something that you should be able to hear. And all animals have gurgly tummies from time to time. If you can hear gurgles, that's good news. If you can't hear gurgles, that's possibly you just can't hear them, but that would be something to mention to the vet. Is he panting? Are his nostrils flaring? Any signs of knocks and abrasions on him? Quite often, if they've got abrasions over the eyes, that's because they've been down rolling or throwing themselves around. So any cuts or scratches on him. And then the T stands for being tired or lethargic. Is he just standing around with his head down? Quite often animals that have been colicking for some time are absolutely exhausted and will be just showing signs of being extremely tired. So those are all signs to consider and could indicate that your horse has got colic, and absolutely phone the vet in the first instance. Whilst you phone the vet, also make sure your horse hasn't got anything to eat or drink. So remove food, remove the water. Make sure he's in with a good deep bedding. If he wants to lie down, that's fine. Let him lie down. He'll probably be very tired. And horses don't twist their gut through rolling. That's a little bit of an old wives' tale. However, excessive rolling will just tire them out even more. So if they're throwing themselves around on the ground, it might be an idea to get them up. However, you must always consider your own safety as well. And if they're being quite dramatic in the stable, you're best to keep out. So there we go. That's a little bit about colic. A few words about biosecurity, because this is very much a topic now that we're in the middle of a coronavirus crisis. And also last year we had an influenza outbreak in horses. Earlier this year we had a herpes outbreak in horses. So what I want you to do is consider that if your horse is clearly not very well, and especially if he's got a temperature, you should try and isolate him from any other horses until it's been established why he's poorly. And likewise, you should try and keep yourself away from any other horses, because you could transmit a disease. So biosecurity is much more important than perhaps we've considered in the past. And then the last topic, briefly, is the important topic of preventative health care. Whilst some horses will always become ill or have problems, a lot of problems can be avoided. So we're talking about daily checking, being aware of what their weight is, that they're not losing weight, they're not putting weight on. A lot of people use condition scoring schemes now, and they're well worth using. Other routine care, veterinary routine care is vaccination, obviously. We can routinely vaccinate them against flu and tetanus, and they should always be vaccinated against these two awful diseases. There are other diseases that we can vaccinate against, herpes virus. There's hopefully a vaccine coming out against strangles in the not too distant future. So vaccination is an important way to go. Worming, obviously, that's something else that is very routine. We would always encourage what we call strategic worming. So in other words, worm egg counts to determine whether they do need worming, and then discussing with your vet what they should have. Dentistry, again, so much can be avoided, including colic. One of the causes of colic is poor dentistry. So again, routine dental work done by either a qualified equine dental technician or by a vet. And I will always bang on about the importance of good, regular foot care. Look after your farrier. You want to look after their feet, and your farrier, if you look after your farrier, he will do a good job for you. And the old saying, no foot, no horse, is very, very true. Look after their feet. Don't cut back on foot care. So that's enough for now.